Peter Zanoni. I'm the city manager for the city of Corpus Christi. And we're here today on a Friday at 3 o'clock, a little past 3, to do our weekly briefing on COVID-19 as presented by Texas A&M Corpus Christi. And the background story, if you're just joining us, I know many people watch us every week, but many months ago when the COVID pandemic began across the globe and here locally, one thing we were doing locally is counting the number of cases and reporting to the community on new cases and recoveries and so on. But what we didn't have is any projection. We had no clue of what was our curve going to be. We heard on network news channels that there was a curve in some parts of the country, and like New York, where there was a big outbreak, but we didn't have a good sense of what our curve would look like or what the future would look like. And so we asked Dr. Miller from Texas A&M Corpus Christi, does she have a group that could help us? And before I could say much more, she said, yes, we'll put together a group, and we most certainly do. And so we've been fortunate as a community and as a region, because the folks from Corpus Christi A&M are doing future projection, not just for our city and our county, but a coastal bend region. And so it's helping the entire region in terms of forecasting. They're showing projections, but they're also showing real-time data and what it means to trending in the past and then into the future. And so that's kind of the background of what this briefing will be today. It's brought to us by Dr. Bird, who's the lead professor that's doing the modeling. It uses national, actually international, right, models, and it takes local data and data from Texas. And those projections that are made, it also uses things like cell phone data to report out how people are moving around and how close they are. And last week there was some pretty cool break-offs from the cell phone data showing how many people have traveled to home improvement stores versus restaurants versus airports and so on. So today is another briefing to show what's happened. One thing we do know is cases are going up across the country in certain areas, but we know for a fact that we have more cases in Nueces County this week than we did last week. And in fact, this week's count is one of the highest weeks since we've been counting. And so our health director is not here, but our assistant health director is, Dr. Dante Gonzalez. And as questions come up at the end of it, he may come up to present some of the answers. But we have to be mindful of what the health professionals tell us, which is some of the basics, which include we don't have a vaccine, there's no cure for coronavirus, we have no immune system in our body for the virus, and we can continue to be safe, though, by practicing some of the things we've been saying for months, which is social distance, stay 6 feet or greater away from somebody unless you have a face mask on, so wear your face mask if you're in public or in confined spaces. Don't touch your face, especially your eyes, your nose, your ears, your mouth, with hands that may be dirty, because if you did contact the virus, that's the best way for it to get into your body. And be mindful of your surroundings, and try to, even though the stay-at-home orders have been lifted, it's still probably better to minimize travel and engagement in various commercial settings. So those are some of the things that we can do to keep safe. And we just wanted to remind you of those today. One thing I do want to do before I turn it over to Dr. Bird is thank all the broadcasts that have aired these briefings, both this and the Wednesday one that the elected officials and myself do. And I've consistently thanked, because they're right here in front of me, and I see their T-shirts and logos, Chris Six and KIII, but also KRO is a network, that's a Spanish network that's been covering these as well. We want to thank them. And then also we have one radio channel here locally, which is KEDT, FM radio 90.3. And they have been covering our briefings live from the beginning on that radio station, 90.3 KEDT radio. So we want to thank them, their radio station, and all their broadcasters that help make that live to the community if they want to listen to it on the radio. Okay, so with that, we're going to have Dr. Bird come up, and he may say it, but I'll say it again as well, which is that he has staff that are here with him, part of his team. And so as the community who watch on Facebook note in questions, type in questions, they're tracking them. And at the end of Dr. Bird's presentation, there'll be a kind of a Q&A session with a summary of the questions. And we have professionals here like Dr. Gonzalez, myself, and others that can help answer some of the questions that oppose to Dr. Bird or others in a summary way at the end of the presentation. Okay, so thank you for watching, and we'll have Dr. Bird come up.
All right, thank you very much, and good afternoon, everybody. This is, the 10th presentation, approximately, that we've done. Last week when I got up here, I said, okay, we've had 1 month of Open Texas, and it looked like we were doing pretty good. Well, now we have 1 month and 1 week, and things look fairly different now than they did last week. Last week, we were on a little bit of an uptick. It was hard to say what was going to happen in the future. For the past 7 days, there's been almost steady increases every single day in the various metrics that we're looking at. So the task force, the TAMU CC task force, our purpose is to address public concerns about COVID-19 and the interventions that are being taken to address the COVID-19 pandemic. Today, as for the past few of these presentations, we're going to answer questions that you pose on Facebook Live. And if the question's too hard for me to answer, we'll get back to you after or the next week. Some questions we got asked last week were maybe more appropriate for the public health director than myself, but I will address them a little bit today in the presentation. Our other purpose is to enable evidence-based decision-making. What this means is that you don't go with your gut, you go with what the data says. Here's what the data says based on the evidence. Here's the paths forward that we have, and you make decisions based upon that. So the presentation is divided up into 3 sections. The first section is on the case data. So let's talk about the case data. This is a heat map of the Coastal Bend area. This report is for the 12-county Coastal Bend area. Sometimes we'll have Nueces or Corpus Christi. I'll let you know when we're talking about different areas other than the Coastal Bend. Nueces County has the most cases overall, or has had the most cases, with San Patricio in a very distant second, and then it goes down from there. Today, our updates for Nueces are 321 total cases, with 123 or 113 active cases, 205 recoveries, and 3 fatalities. So I'm doing on this slide this week so that it doesn't cloud up the next slide where we just talk about the Coastal Bend. So we show a slide like this every week. Like I said, this time it's just going to include the cases for the Coastal Bend. These are the total cumulative cases. On the top, 438 in the Coastal Bend. The way that a case gets recorded is a person has to have a positive PCR-based test. What that means is not antibody test, only PCR test gets you onto this list. There's been 286 recoveries. And there's 148 active cases presently in the Coastal Bend. There have been 4 fatalities so far in the Coastal Bend. It's been very steady for a long period of time, but if we have increases in the number of cases like we're seeing, it will only be a matter of time before this number increases also. What I want to point your attention to is this was the meatpacking plant and transitional housing outbreaks that occurred, and you can see that there's a change in the slope of the line. That distinct change in the slope of the line indicates that we're accumulating cases more quickly. It leveled off again, and you can see now we're turning up, and we've turned up, and for the past about 2 weeks, week and a half, there's been a consistent uptick in the accumulation of new cases, and so that's what we're concerned with. It's not as steep as it was for those outbreaks before, but that doesn't mean that this is less dangerous in any way. We always compare to San Antonio, but this week, each week we improve certain aspects of the presentation, and this week we're going to give you a much richer comparison of Corpus Christi and the Coastal Bend to other places. But we'll start with this comparison to San Antonio, where we put it on a per capita basis, the number of cumulative cases per 100,000 individuals, and you can see there's about 2.5 times more cases in San Antonio per capita than there is here in the Coastal Bend. I know in the past some people have said, well, that's not a fair comparison, And I understand what people are saying. We're not trying to pull the wool over your eyes. And what I've seen on the news, as Texas becomes more of a focus of the national news, I think it's more important for us to address broader Texas trends and how the coastal bend fits within those broader trends, and to help us better understand what's happening here versus what we hear on the national news. So this is a new figure that we're showing for the first time this week. And so I'll take a little bit of time. It's just like the last figure, except there's more locations on it. So we have the total cases per 100,000. It's cumulative over time. And now we have our different areas in the South Texas region. We call this Public Health Region 11. It's an area that's managed as a group. And these are the metro areas. And I don't define what a metro area is. The state did. And so they called these metro areas. I don't know if Aransas qualifies in my own mind, but that's why it's on here. And we have 3 coastal bend counties that we can get a feel for what's happening. And what you can see is Laredo has, and Brownsville, and the counties that they're in, have a much higher rate of COVID-19 cases than we have here. McAllen is a little bit higher than us, and you can see that there's been a little bit trade back and forth between McAllen and Nueces. And then Portland and Aransas are down at the bottom there. So at the end, you can see there's a lot more cases per capita in Laredo and Brownsville than there are here locally. And the scale of the differences there, they're even a little bit greater than San Antonio. Okay, let's zoom out a little farther to a greater span of Texas. So now we have just the public health regions that I talked about. In the last slide, we were just looking at Public Health Region 11, which we are a part of. That's right here. And it's hard to see the line, but it's right underneath El Paso. So we in El Paso have approximately the same number of cases per 100,000 individuals in almost the whole course of the pandemic thus far. And so this is good for us because we're down on the bottom. Down on the bottom is good. If you're higher up, that means there's more cases, there's more COVID-19, and it's maybe a place where you're more likely to contract COVID-19. So far and away, the area with the highest number of cases per capita is in this northern region of Texas where Amarillo is. And then there's a big jump down to Dallas, Houston, Longview, which is out here, Austin, right, San Antonio, El Paso, and us. So this should give you a better idea of where we stand within the greater trends in Texas. So this last graph, these are all cumulative, total number of cases over the whole course of the whole pandemic. What about the number of new cases per day? When I've shown these plots in the past, I show each day's data point, but with this many lines, there's too many data points. So we subtracted the data points off of here, and we're just showing the smoother lines. The actual data points can go higher than the line or lower than the line. What the line represents is essentially a moving average, a little bit more sophisticated than a moving average of the new cases per day per 100,000 individuals in the different areas. And here, unlike with the last view, El Paso comes out at the top right now, followed by Amarillo, then Houston, Dallas, Austin, San Antonio, and then us down here in the coastal bend, and lastly, Longview out here in the upper northeast corner of Texas. So the span here of number of new cases per day goes from somewhere about 5 to about 8 or 9 new cases per day per 100,000 individuals. And so there is, again, a fair bit of spread, and we're on the positive side of this equation, down low, as opposed to higher up with higher numbers. And you can see at some point Amarillo really went to a lot of cases, and Aransas. And around here, it makes a lot of sense that Nueces would have more cases than Portland or Aransas on average per day. But you can see there was a period of time not very long ago where there were more cases per capita in Portland than there were here in Nueces County, where we are today. What you should also pay attention to is all of these, except for Portland, are going up. Aransas is going up a little bit. Nueces is going up, McAllen, Laredo, Brownsville, all going up. On the last slide, almost everything except for Longview is going up over the past week. So this maybe gives you a little bit of context. When you see on the news there's more cases in Texas, this is what it looks like at a little bit more granular level. And here's where we fall out, down near the bottom, luckily, but this upward trend is concerning right now. If we zoom in even farther, so here we have Nueces as this teal line. You can see here's the outbreaks, and we came down, and now we're going up again. One thing that I think is pretty important before I go to the next slide is look where we are versus where we were at the beginning of the pandemic when we were trying to flatten the curve. We're higher. There's more new cases per day right now than there were then. Now, this could be because it's easier to get a test now than it was then, and that's going to be part of it. But it's not going to take too many more days before we're even higher than that STX outbreak if things keep going the way they are. So I think people really need to pay attention right now because this is possibly the way exponential growth works is it doesn't slow down, it gets faster. And that's the way the virus spreads. We zoom in a little bit farther, just to the coastal bend, every county except for Nueces, because if we put Nueces on here, it might be difficult to see the rest of the points. There's a new outbreak that we have in the coastal bend. It's at the jail in B County. And you can see there's a few very high numbers of new cases. We can see those kind of brown points from B County in the past week. And we've got confirmation from the health district that this is associated with the TDCJ facility there in B County. Now, this is not driving Nueces as far as we know. This is driving B County and maybe a couple other counties in that area. We'll be getting more information as the tests come in to see which positive tests are associated with this new outbreak that we have in the coastal bend area. Okay, now this brings us to the last things that we're looking at, which is the number of tests. So the first thing you'll see is that, wow, we've had this huge decline in the number of tests. What's going on? Well, we had to ramp up the testing for the STX outbreak and for some of the other housing facility outbreaks that were occurring. And then secondly, testing ramped up for nursing homes. So what was happening during these periods of time that you see in the dashed boxes are that we were census surveying everybody associated with a nursing home, census surveying everybody associated with an outbreak, whether it was a transitional housing facility or a meatpacking plant. People were getting tested that had no symptoms, never had any symptoms. And that testing is sort of subsided for the most part at this point. And so that's why it's going down. There is not a lack of testing. If anything, you can see that we should be able to ramp up again to those levels or even higher from what I've heard from others in Nueces County. And what this represents is this just number of people that are getting sick, calling their doctor, calling the hotline, getting referred to get a test, actually go through with getting the test, and then they find out their results. Now, here's the other side of this equation, is when people are finding out their results these days, more of them are finding out that they're positive proportionately than in the past. So it's not just that there's more cases, there's also, we're seeing a higher proportion of the tests coming back positive. And you could look at this a few ways. One way is that, okay, before, when you were sick, before the outbreaks and you got tested, you had somewhere around a 1% to 2% chance of actually testing positive for COVID-19. Now, in the last day or two, it's more like 4%, a 4% chance. And that could be because some of the other diseases that we commonly get in the wintertime are going away, and COVID-19 is becoming more prevalent among all the different sicknesses that we're contracting. But I want to address something very specifically. This percentage is not increasing because the number of tests is decreasing. This percentage is increasing because there's more positive tests. We have less tests overall, but more positive cases per day. So that's not just because of a decline in the number of tests, it's because there's an increase in the number of people that have COVID-19 and are getting tested. So this is not some sort of a statistical artifact. We're able to very confidently say that this is something beyond just a decrease in the number of tests. Okay, moving forward. The cell phone data. So the purpose of the cell phone data is to give us a view into the future. The cell phone data can tell us what people are doing, how they're behaving, and you can go out and kind of get a gut feeling for what's happening in Corpus Christi, and I definitely like to do that. But it's not really objective unless you sit there and you collect a lot of data. It would take a lot of manpower and a lot of effort to be able to do that. Instead, what we do is we use publicly available cell phone data, which normally you have to buy, but because of COVID-19, some of the companies that buy and sell this data have made some of it freely available to us as scientists. Now, you might be wondering, how is this possible? Why are people watching me? Well, as soon as you use Google Maps and you click OK and let it use your GPS, it's going to be tracking you. And not just when you're using the maps, all the time, as long as that app is active and has access to the GPS. Facebook, if you're on Facebook, when you load it, it asks you, do you want to let it connect to your GPS and your contacts and all that? And of course, you usually say yes. So then Facebook is tracking where you're going. So this is where that data is coming from. It's anonymized, so it doesn't have your name attached to it when it's bought and sold commercially, and the data that we get certainly doesn't have anybody's names attached to it. But there is the ability to tell where home is and how often people are leaving home, or when people stay home, or when people go to Home Depot. Now, I don't know when Manager Zanoni went to Home Depot. I just know that there was a lot of people that went to Home Depot since the pandemic started. So that's how it works. This is, like I've said before, probably one of the few times in your lives it's ever going to be used for good. And usually it's going to be used to try to sell you something, which may be good or bad. So let's review the reason why we look at the cell phone data. It's about interventions and how effective they are. So the interventions in place are: 1, stay at home if you can. And we're going to look at, are people still staying at home? 2, there's further loosening of restrictions on social and public gatherings, and that may be some of what's happening to us now, where we're starting to increase with the number of cases. As we slowly go back to normal, we're going to slowly have more and more contacts, and slowly the transmission rate of COVID-19 is going to increase if other things don't come into play. School closures are still in effect. Social distancing, everybody should be staying at least 6 feet apart. The way that I like to think about it is, if you see somebody with a vicious dog on a leash that's 6 feet long, you don't just get exactly 6 feet away. You stay 12 feet away, right? So that's kind of the way that I treat it. And I think about this because I have a Doberman, and nobody wants to come within 6 feet of me when I have him on the leash. Lastly, self-isolate when symptomatic. What this means is, if you're sick, if you have a sniffle, if you have that tickle in the back of your throat, you don't decide if you have COVID-19 or not. You immediately self-isolate and contact your health professional. And I say it like that because one of my friends decided that they didn't have it, and I had to talk them into getting a test. And I said, well, how do you know you don't have it? They're like, well, I don't have all of the symptoms. I was like, well, you don't need to have any of the symptoms to have COVID-19. There's plenty of asymptomatics, or you could be pre-symptomatic, where you're going to get the symptoms, but you haven't gotten them yet. So any one symptom that's even closely related, which is pretty much anything that looks like a cold or a flu, then you want to self-isolate and get medical attention, and this will stop you from spreading COVID-19 further if you do have it. Okay, so with that, let's look at the cell phone data. Again, school closures are effective, but we have a new development. Last week, this was pretty flat-lined out, but this week, universities is ticking up. And there's only one university that's on this list, as far as I know. It's Texas A&M University Corpus Christi, where I myself work. And the only way that I can explain it is that I know that restrictions there have been loosened in the past week, and more people are going back into work. Before that time, I knew some graduate students were going into the lab to work, but there's more staff that are going back now, and there's probably more faculty that are going back. So that's why we see that kind of rapid uptick in the universities in the past week. And just to calibrate, for those of you that aren't familiar, this is a relative index where we define 100 as normal. Normal means the way that we were behaving before COVID-19 really started and we realized it was here. And this is a foot traffic metric. So if a device goes into a facility, it gets recorded. And we record the number of visits that occur across the periods of time. And that way we can compare to what it was like before and get this metric. 0 means 0. And when we get back up to 100, it means the same amount of foot traffic is occurring at those locations as happened in February and March before COVID-19 started, or at least before we realized that it started. Next one we're going to look at is the proportion of people leaving home. So that's the blue line here. And the important thing to look at is where was normal, where did it go down to in the middle of the stay-at-home, and then where did we get back to since that time? So we're about 66% of the way back to a normal pattern of people leaving home. So what that means is there's still about 33% of the people that were changing their behavior still are changing their behavior. I'm one of those 33% of people. The only time I go out in public is right now, each Friday at 3 o'clock to give this presentation. And beyond that, I don't go into stores, I don't go to school. I work in my yard, and I work on these models and this data. The other metric there is distance traveled. You can see there's a peak here. So I don't have it animated, but this was spring break. The other peak is Memorial Day weekend on the other side, and we're kind of a little downswing from Memorial Day weekend, and that makes a lot of sense because I don't think we've seen traffic backed up from the island out to the Lowe's home improvement store like we did during Memorial Day weekend. Less people are traveling on the weekends than were on Memorial Day weekend. It makes a lot of sense. But there's still a lot of travel going on, and we're way up from where we were in the middle of the stay-at-home. So what this means is that people are going places, people are going to work, people are going on trips, going to the beach. That distance traveled is increasing overall, but we have a localized decrease since Memorial Day weekend. Just wait for the 4th of July. I expect we'll see that tick back up, barring some major change in our behavior because of the pandemic. This one is the encounter index, and I like this one a lot because it's actually trying to estimate the probability that you're going to encounter somebody else within 6 feet, actually come in contact with them. So again, 100 is normal, that dotted line. And what you'll notice is I have this broken out by weekdays and weekends, essentially. Friday through Sunday show a similar pattern, and it's a lot more pleasing to see 2 lines than 7. So what you can see is that we've gotten all the way back to a normal pattern where there's more encounters happening on average in Nueces County on the weekends than on weekdays, just like before the pandemic started. And it peaked on Memorial Day. Now it's going back down on the weekends. And for the weekdays, it's kind of plateaued. So this probably has something to do with the 33% of people that that are still staying at home, of all the people that were staying at home at the height of the stay-at-home period, and probably just still a decrease in our going to parties, the movie theaters. Not a lot of people are going to movie theaters. Whataburger Field is not packed with people, so there's a lot of places where we would get encounters that we're not getting right now. So this could go much higher than it is. So at least on the weekdays, luckily it's not all the way back up to normal, but both of these have been on an increasing trend overall. Weekdays and weekends, there we have Memorial Day. All right, medical office foot traffic, and I kind of like this one because I like comparing how much foot traffic are we getting at what I would consider maybe a less essential to your immediate health, like eye doctors and dentists. No offense to anybody out there, but I might be able to put off my root canal for a couple weeks, but if I have a stroke, it's kind of hard to put that off, right? So comparing eye and dental to hospitals and doctors' offices and the laboratories associated with that. And for a period of time, there was a run on the eye doctors and dentists after the stay-at-home ended and Open Texas started. Since that point in time, there's been a decline in eye and dental and still a steady uptick in people going to the doctors. Last week, I talked about that, I would go to have my physical. I scheduled an appointment, and this is something everybody should be aware of. I wasn't able to get an appointment until August. Because of COVID-19, all the appointments that got deferred are now being seen, and because of COVID-19, they can't see as many people at the same time. So if you want to go in for a physical, you should call your doctor now because it may take a long time before you can actually get in there to have that done. So there's a few reasons why doctors' offices and labs aren't higher. One is that there's not as many people that can go in. Another one is that people are doing telehealth. And so for all the people that are doing telehealth and getting telehealth, that's one way that it would decrease the foot traffic at doctors' offices. Okay, one last thing. If you have a major medical problem, it's very important that you go to the hospital. You're much more likely to have a negative medical outcome if you have heart pains, chest pains, and you don't go to the doctor or the hospital because of COVID-19 than if you do. Okay, last one on the cell phones, and we kind of ramped up in the complexity here. Just look at blue versus the browns. Blue is essential, brown's non-essential. And what you can see is that the essentials were higher, but the non-essentials are coming up, just like last week. So we still have a very high level of home improvement. Seems like everybody's working on their houses right now, and this isn't just kind of doomsday prepping. It looks like really something that's sustained through time, well after kind of prepping periods. Say like the grocery stores, there was that, everybody going out to get toilet paper and sanitizer, and then the drop off and coming back up, versus the home improvement stores. There's a lot of activity going on there. Now let's compare those to malls. There's now as much, on a relative basis, as much traffic as at the malls as there is at the grocery stores. And so this is kind of a non-essential visit usually. And this gives you an idea of how comfortable people are with going out. So right now we're just as comfortable with going to the mall as we are with going to the grocery store relative to the way we were before the pandemic started. Restaurants are also up to that level. They've increased over the past week. Bars are on a steady uptick, an even faster uptick since they've been able to open. But movies and motion picture theaters still have a very low level of foot traffic, and it seems that we've determined that that may not be as essential as going to the bar or restaurant or the mall. It is what it is. So it's pretty interesting. All right, the whole point of that data is to tell us, well, what's going to happen in the future? Well, there's a lot of non-essential visits going on. There's a lot of contacts going on. It's increasing. And so these are things that we think are going to lead to a higher transmission rate. And the thing that was stumping us for the past 2-3 weeks was, why are the number of cases going down? Why aren't we seeing an increase? Because we see all these cell phone metrics going up. Well, it seems that in the past 10 days, this has come to fruition. And I do have a couple hypotheses on how we've ended up where we are now that I'll talk about at the end. So last part, model estimates and predictions. And this is a slide we added last week. I want to emphasize again, everything you've seen before this point is essentially a very sophisticated way of drawing lines through data points. Everything after this point is an uber sophisticated way of drawing lines and ribbons that aren't necessarily drawn straight through the data points. They're generated by a mechanistic model that's based upon the way the pandemic works. There's the susceptible population, which is most of us. Most people haven't contracted COVID-19 right now. And what that means is that if a lot of people haven't contracted it, it means there's a lot of people that could contract it. It's one of the reasons why we're very concerned right now. Once you contract it, you become infectious in about 5 days, maybe 4 days, depending on who you are. Sometimes it could take a little bit longer. Once you're infectious, you could infect other people. Now that's going to be mitigated by interventions and the transmission rate overall. It's going to be mitigated by your decisions. Do you go on those non-essential visits? Do you throw parties? Things like that. Are you not social distancing? Do you not wear masks? Those types of things will make you more and more likely to infect other people. Do you not isolate when symptomatic? And then more susceptible people could become infectious. People can move from infectious to recovered, or they can go over on this side of things. They can move from infectious to the hospital with a very severe case. If somebody's, and so this is the way these models are working overall, is we're kind of modeling everybody as a population, and everybody's in a bin. And people are moving between the bins from time point to time point. You can go from the hospital to the ICU if you have extremely severe symptoms. In very rare cases, mortality occurs, but in most cases, people get out of the ICU, back to the hospital, and eventually get over to recovered. So these are the processes that are going on under the models that you're going to see the results from next. Here's one example of an output where this is not a line drawn through points. This is the blue ribbon and the gray ribbon are model-generated predictions on the number of average fatalities per day in Texas that have occurred, and then the gray is projected out into the future that will occur in the future. And this isn't just an example. This is our actual figure for this week. We don't talk about this model too much because we haven't had a fatality in several weeks in the Coastal Bend area, and it's not a big focus, but we thought this was a good way to explain the difference between what came before and what comes after. So based on that model of fatalities, one thing we estimate is the transmission rate before interventions ever occurred, which is now 2.9. You'll notice sometimes this number changes from week to week. Last week it was 2.7. In reality, the number never changes, but our estimate of it can change from week to week as we get more and more data. Ideally, what will happen over time is the number will stop changing and we will have honed in on what the most likely number actually is. What 2.9 means, this is the transmission rate. It means that if you get sick, you're probably going to transmit the virus to 2.9 additional people, usually 3, sometimes 2. This is without interventions. It's not necessarily the case of what's happening in Corpus Christi right now, but it's our estimate of what the case would be in South Texas if no interventions were in place. 3 would infect 8 after 2 weeks. Those 8 would infect 24 after 3 weeks, and those 24 would infect 71 after 4 weeks. Now this is additive, so you add all these numbers up. That's 107 people that are infected after 1 month from one person. Now, if you notice, this number last week was 2.7, and it was 74 people infected. So there's almost 30 more, there's more than 30 more people projected to be infected in a month's time, just because of that small difference in the transmission rate. And that's why we're so concerned with this number. Now, this is our estimate of the transmission rate right now with the interventions in place. And I want to emphasize again that this model is driven on fatalities. It's not driven on cases. What the number 0.9 means is that it means more likely than not, we're on a downward trend. Now, this model is not designed for a roller coaster ride that's not triggered by decisions that we make. The way the model works is interventions go into place or they get repealed, the model knows about them, and then it's estimating these values from that. Now, the reason why we have a number that maybe doesn't quite match what we're seeing right now is that no interventions have occurred recently, and no interventions explicitly have been removed recently that will have triggered some sort of change. So the model is dealing with a situation that shouldn't happen, where we went down, and now we're headed back up, and no change in policy really occurred except for this steady ramping back of policy in time. So it may take a week or two for this to kind of like snap back. But what I can say is underneath this number, there's more digits, and it's been increasing slowly over the past about 5 days. It hit a low just past last week's presentation, and it started increasing again. So this probability right now is equivalent to rolling 2 dice and getting anything other than a 12, a 3, or a 2. That's your probability of transmitting from one generation to the next, and the generation is the virus generation. And we project right now that this is an average rate of 5 infected per month. Now, there's a range on this. The range goes up to 1, but we fully expect that this is a low estimate right now, and that the actual transmission rate is probably above 0.9. Now, the reason why we're still showing this and presenting is that, well, sometimes numbers go up and sometimes numbers come down, and only the future will tell. We're kind of in a novel situation here with a novel virus, and we're not sure. Last week, I was saying, well, it looks like we have a little bit of a Memorial Day bump. We'll see next week what it looks like. Well, we're either having a really big Memorial Day bump, or there's something even more that's getting triggered here beyond a Memorial Day bump. So these are values that are just like this value. So the 0.9 is actually a 0.88. And so this is for our region of Texas. For the numbers overall, they have declined since last week, but they're starting to increase again over all of Texas. And I think the important thing to focus on this slide is not the numbers themselves, but the geographic pattern that still lies there that you also saw in the number of new cases, where there is some sort of geographic pattern north-south in the number of cases, in the estimated transmission rate, and this is something that we're still seeing. My best explanation for what we've seen is that while we were opening Texas, there maybe was a mild seasonal effect where the transmission rate of COVID was decreasing slightly. And it kind of made it so we couldn't quite see what was happening. But a seasonal effect doesn't mean that the virus goes away. It just means that the probability of transmission can decrease by a certain amount. That amount that it decreases could be 0%, or it could be up to something like 40%. Now, if as we warmed up, we had a little bit of a decrease in the transmission rate, as we were opening up Texas, it would make it look like, either we're declining a little bit or there's no change. But then eventually, if our behavior goes to the point and our interactions go to the point where it outstrips the benefits of that seasonal effect, that we can start to go up again. So that's my best explanation, or I'd say right now it's a hypothesis for what's occurring. Either we were level because of a seasonal effect or going down because of a seasonal effect. And then we're seeing it now because as we've opened more and more, we've pushed that transmission rate back above 1. Or we were low to start with, and as we opened Texas, the transmission rate was just slowly increasing through time, and now we've transitioned. And the bump that we saw was just some isolated outbreak at a facility that maybe secondary contacts spread out into the community also. So I know that's a little bit complicated, but we have a weird result this week, so I wanted to spend a little bit of time explaining it. Peter, do you have any questions? Okay, so I think I did an all right job, or I did a horrible job. We'll see. All right, this brings us to our last model. This is a different model, and we've been running it for the past few weeks based upon the previous model. The previous model gives us the transmission rates. This model runs based upon that, as well as the number of new cases. And we have to make a decision. Just like the other model, it doesn't like, it was only ever designed really for one curve, up and down. Now, what we've had at this point, if you're paying attention to the number of new cases, is we're on our third wave, if you will. Now, maybe they're small waves, but we had the initial wave where we flattened that curve. Then we had the outbreaks. That went up and we flattened that. And now we're going up again. So that's the third time that we're going up. So every time there's that change, it takes a lot of effort to bend this model to model that change. And we have to have a really good reason why we're going to change the model. Otherwise, we could just spend each day saying, oh, well, the model should go up there and then it should go down there. We have to decide a time frame over which the model is projecting a certain way before we decide, okay, there's really been a change and we need to model that aspect of it. For now, we didn't change it. We left it the same way that it was last week. We're running it off of that 0.9. The blue is our projected number of people in the hospital per day. The red are the actual number of people in the hospital per day, and right now it's tracking pretty close. Now, based upon the other information that we have at our disposal with the number of new cases increasing, I would say that we're probably going to see this depart, the red dots depart from the blue line. And what we'll do is we'll work on this over the weekend, and probably by Monday we'll have a new version of the model that is now decided that the transmission rate is increasing, and we'll have new projections on what that's like. But the difference is going to be very subtle right now. It's good, instead of something that's stepping down a little bit, it's probably going to be something that's stepping up ever so slightly, like you see there. Same thing with the ICU. Again, we saw no reason right now to change this, given that it has very good prediction value on the points that have occurred. And what we expect, again, is the number of people in the ICU based upon the number of new cases that we're seeing. Maybe this is going to tick up instead of ticking down as the transmission rate transitions from below 1 to above 1, which is what we think we're seeing. Oh, and something that's really important to emphasize, we're nowhere near the limits. The way we're showing the capacity of the hospital is based upon how much room is there. And this has been a real education for me. The way the hospitals work is they flex. And as there's more and more demand, more and more doctors and nurses get called in. And as there's less demand, there's less. So what we're using is long-term averages on the amount of flex that's available. in the system, and there's at least flex for 30 patients above and beyond the average conditions in the Coastal Bend area in the ICU, and 350 additional patients. So those would be the patients that we're attributing to COVID, and that's how we're measuring this. There's not 30 beds, there's 30 beds for COVID patients on average, and that's ICU beds. Okay, in summary, the new cases in the Coastal Bend are obviously increasing. You've seen it on the news. You've seen on the national news that Texas is going up, and we're seeing that locally too. But you saw within the context of the greater scheme of Texas that we have far fewer cases per capita, both cumulative and on a daily basis right now, than most other places in Texas. I think what we're seeing here is a combination of a Memorial Day bump combined with a relaxation of the interventions. Less people are staying at home, more people are going to restaurants and going to the malls. Maybe there's a little bit of relaxation on wearing of masks. We're not sure, we don't have information on that, but something's happening that seems to be kicking the transmission rate up. Non-essential activity is increasing. We see this with the phones. We've been seeing this with the phones since Easter. From Easter pretty much forward to Memorial Day, there's been increasing activity. And if you take Memorial Day out, which is kind of an aberrant holiday in that it's not every day that's like Memorial Day, right? We still are seeing increases over time. If we take Memorial Day out, we're still seeing increases. Now we see a decrease from Memorial Day, but that's a huge peak to come down from. And if anything, I'd say that our goal is to not achieve that peak on the 4th of July. So maybe we can start planning right now to try to not hit that level of encounters on the 4th of July that we hit on Memorial Day. COVID-19 is expanding in South Texas. I'm saying this despite the model saying that it's not expanding. I think that with the data that we're seeing with the increases in number of new cases, we're seeing the model prediction come up, and we think that it's eventually going to catch up with what's happening. That model that predicts the transmission rate, it's based upon fatalities. It takes a fair amount of time between when you get confirmed with COVID-19 and God forbid you have a really bad outcome and meet mortality. It takes a long time for that to occur, and that's one of the reasons why there's a lag, combined with the fact that the model's not used to having to change directions from going down to going up without an additional intervention being put in place or taken away. There's a geographic pattern in the transmission rate in Texas. That's still certainly the case, this north-south pattern. And I think what you saw when we contextualized the number of cases in the Coastal Bend compared to the rest of Texas, that there's also a north-south pattern in the overall cases and the number of new cases per day that you can also see. Hospitals presently are well within capacity. We're communicating with the hospitals. They communicate with us. When we see changes, we let each other know. And so that should let you rest easy that we're watching that. The big thing that we're concerned with is we don't want the hospitals to overflow. The reason why is that if the hospitals hit capacity, then if you need medical attention, you might not be able to get it. Say you're in a car accident, these types of things you can't foresee. You can say, well, I'm a healthy person, but you can't predict what might happen in the future. And what we don't want to happen is come to a point where people can't get medical care because too many people have COVID. It's important to help contain local outbreaks, and again, this is a message for all the managers and companies out there. There's no shame if there's an outbreak at your company. It's very important to comply with the local officials, get everybody tested, let the contact tracing happen, and for the outbreaks that have occurred, those businesses, the leaders that were involved on the political side, the essential workers, the frontline workers, everybody that are involved in containing those outbreaks or being a part of it, they should all be commended for their compliance and for their work to help contain them. We've been successful in containing them so far, and this compliance and comprehensive testing is imperative. The lesson learned here is that you need to close the loopholes in your social distancing policies, or COVID-19 is going to exploit them and point them out to you. You want to find them before COVID does. For everybody else, it's important to realize that we have control over this. We have flattened the curve. We changed our behaviors and COVID-19 started coming back, right? So the things we do make a difference. Wearing a mask makes a difference. Even if you think, well, I'm not going to, infect anybody. I don't have COVID-19. You might be pre-symptomatic. You might be asymptomatic. It's important to wear the face coverings, whether whether you're symptomatic or not. You want to self-isolate when you're symptomatic. That'll help to contain. You want to stay at home if you can, because again, it's hard to know. You don't know you have COVID-19. If you do have COVID-19, but you don't know it, first that's possible, and you're infectious at that point. And so staying home when you can reduce the number of contacts and reduce the transmission. Postponing social gatherings, rethinking your social gatherings in a way where there's appropriate social distancing. These are things that you should try to do. Curbside and takeout, like I said, I haven't stepped foot inside of a building except for this one and Tidal Hall at Texas A&M Corpus Christi since this thing started. I've been here more than there. Curbside at the stores are great. I'm never going to go inside of a store again if they give me curbside. I don't want to go in there. I like that they bring everything out. I can surf the internet while I'm waiting in the parking stall. It's fantastic. Takeout, if you like eating out a lot like I do, you can get takeout. There's DoorDash, there's Grubhub, there's all these different ways that you can get the food delivered to you, and a lot of the restaurants are accommodating you and will bring the food out to your car. Lastly, it's important to support testing and contact tracing. This is the way that we identify people that have COVID when there is an outbreak at a facility, and we contain it. And without that, these outbreaks would spill out into the community. Lastly, you can find us online at tinyurl.com/TAMUCC-COVID for a dashboard and some different reports that we're doing. And we'll start getting more of these graphs onto that website in a report form for you to see, and some of the other ones that we make that we pull back. With that, I'd like to thank all the people that contribute to this task force. I'm the person that you see up here, but I'm standing up here for a lot of people. I get a lot of feedback every week on the work that we're doing and how to interpret the data. And there's a lot of people that are running the models, and they all deserve a lot of credit. And I think now would be a time for either the Facebook Live or other questions from reporters or translation. Translation, we'll do the translation.
Okay. En resumen, de acuerdo a la información más reciente, el reporte de casos por COVID-19 en el área de la costa en los 12 condados está desglosado a 310 en el condado de Nueces, 41 en San Patricio, 27 en el condado de Bee y 20 en el condado de Clayburgh. En el área de la costa se han reportado un total de 438 casos. De esos, 286 personas se han recuperado. 148 casos continúan activos y se han registrado 4 decesos. En el área sur de Texas, la ciudad de Brownsville es la ciudad que ha reportado el mayor número de casos, aunque toda el área ha reportado un mayor número de casos en los últimos días. Las cifras positivas también han aumentado en el condado de Bee, debido a un brote reportado en la prisión. El número de casos positivos está aumentando hasta un 4% y no es el resultado de la realización de un mayor número de pruebas, sino los casos positivos en general. Este estudio también utiliza información prevista por teléfonos celulares y su ubicación conforme al GPS o posicionador global. Las intervenciones no farmacéuticas, como estar en casa, cierre de escuelas, distanciamiento social y el aislamiento cuando se siente enfermo, han hecho una gran diferencia en cuanto a la propagación del virus. La información prevista por los celulares indican que hay un mayor número de tráfico en la universidad, ya que mucha gente regresa a trabajar. Más gente está saliendo de sus hogares, especialmente durante el fin de semana. Esas cifras han regresado casi a su normalidad, o sea, antes de la pandemia. Se estima que una persona infectada puede contagiar hasta 2.9 personas si no se llevan a cabo las intervenciones no farmacéuticas. Esas cuatro personas pueden potencialmente infectar hasta 71 más, pero si se llevan a cabo las intervenciones no farmacéuticas que incluyen el uso de cubrebocas, el distanciamiento social y el lavado de manos frecuente, una persona infectada puede contagiar a 0.9. O sea, una persona por semana. Esa reducción es importante, por eso la sugerencia de tomar todas las precauciones. Esta presentación y las presentaciones previas se encuentran disponibles en su totalidad en la página de Facebook de la ciudad de Corpus Christi y la Universidad Texas A&M de Corpus Christi.
All right, we just have a couple of questions today. So the first question from Facebook is, why does DSHS report 5,000 tests for Nueces County, but the county reports over 12,000?
I can't answer that question. Yeah, so the question is, why does the Texas state website report fewer tests than locally?
So just briefly repeat the question, why is there more tests being reported by DSHS than by the,
The county reports. Tests.
Tests. There's more reported by us than by the state.
yes, so we have been doing a lot of different tests that the Department of State Health Services, they have a criteria that they have to follow. Anything that fits their criteria is what gets reported back to them. There's several other entities that are also doing some tests, which correspond to the number of tests that we're reporting.
Okay. The second one is, it's more a question probably for you, Peter. Why is the state continuing to progress with reopening when the cases are rising?
Let me add to that prior question too. So I think, because we've done a lot of work on the counting the number of tests. So the state's test website is dependent on entities sending data to them. And what we've learned is that entities like private hospitals, commercial labs, even health districts aren't always on time sending data up to the state. So it's been known for years, this isn't the first time we've tracked statistics, that the state database unfortunately isn't the most accurate on a point in time. And so our numbers are more reflective of picking up the phone and talking to somebody locally. And so the more real time, so the more reflective of what's really going on in terms of number of tests. So our tests, we update them every day. We get calls into us from the hospitals. We work with our health district. And so our numbers are more on time. I think the states are lagging a little bit, and that's the issue that we've heard from the beginning. Okay, then the second question is, why is the state opening everything up even though cases are going up, right? You'd have to ask the governor that, but I think we know and we can see by watching any news network that the economy is at stake, and there's a flip side to this. If we keep everything closed, keep everybody home, the economy goes bad, people have no jobs, and then life is just as bad as it is if everybody's sick. So it's a balance in between. We're trying to, the officials, the policymakers are trying to reopen the state, but at the same time, keep the virus, in check. And we can see that's why we have you all here, because we need to really track it and communicate to policymakers about what's happening locally. Yep.
All right, and that pretty much answers the fourth question, so that does it for the Q&A.
Okay. Okay, I think we may have a few questions from the media. Yep. Okay.
Let's see. Is there a concentration of the cases in certain areas? Are we getting the idea that it's maybe tourism driven, or like is Port A got a cluster, Robstown, or we're kind of all over the city and county?
You know that one?
So there's several different clusters that we are seeing, and some of them are not even connected to each other. We do several contact tracing. We communicate with every individual that tests positive, and we try to figure out some sort of pattern so that we can stop it. A lot of these are community driven, right? Sometimes these individuals are out and about, not wearing the proper precautions, not doing the right protocols to ensure that they're preventing any sort of disease, whether it's, right now we're dealing with COVID, but there are several diseases out there that we're also contact tracing people with. The idea that there's a specific area within our county that is like a hotspot, I think that's where you're getting at. We try to track it down, and if there is one, then we talk to the people. We ensure that if it's a place where they've been visiting, or a place where there's more segregated people in there, or there's more people congregating, that we try to reduce some of that. There's really no pattern. There's really clearly no pattern as to why there are certain areas that have a higher spot. It could be that there is more people per capita in that area, or the area of population is more dense in that space. Sometimes it's a little bit more broad, but these people are the ones that are traveling outside and bringing it back in. So there's really no pattern right now that we could say this is specifically why this area right here has more cases than all the other ones.
Is, say, Port Aransas one of those areas, though, that you've looked into?
We look at everything that is Nueces County. Part of Port Aransas is part of Nueces County, so we do look at that.
There was a mention of the Memorial Day bump. Should we, or are we considering tightening restrictions so we don't see that again on July 4th? That might be more for you, Peter.
I'll add something at the beginning of that. So, as we start to reopen, right, and the governor decides, hey, now we're going to move into a different phase, the public has to remember that it's not just about the reopening. You still have to follow the right prevention tools, making sure they're wearing a mask. So if people are starting now to be more lackadaisical about not wearing a mask, they're like, well, I'm just going to go really quick, and then I'm going to come back. You have to remember, just because the state is opening and the economy is opening back up, we still have to follow the exact same measures that are being already set to prevent any sort of communicable disease. So if you're wearing your mask, if you're washing your hands, not touching your face, your mouth with dirty hands, that's going to reduce, even though we're reopening, if we're following the prevention tools and the prevention mechanisms that are already set in place, it is going to drive that curve down because we're still following those protocols.
Take it upon yourself to do your diligence. It's not necessarily something that the government has to step up and.
Absolutely. You want to do your part, because at the end of the day, the person that's getting sick is going to be you, right? Your family is going to get affected by this particular disease. So what you want to do is you want to ensure that you're protecting yourself, and by protecting yourself, you're going to protect your community. So it's kind of like an effort on your own as well as for the rest of the people. We provide the communication, we provide the information. We spend a lot of hours trying to put all this stuff together so that the public can make a more educated response to what's happening out there. Some people think that this is not real. Some people still think and are in that mentality that maybe this is not happening to our county or our country or worldwide. But the truth of the matter is, it is happening everywhere in the world. It's happening here in our hometown. And we want to make sure that you're doing your part as well as we're doing our part. So from the public health perspective, we are contact tracing everybody to reduce the spread. That's what we want to do. We want to break the link of infection, and we want to make sure that you have all that information readily available for you so you can make a very educated decision as to how you're going to do the weekend, right? You saw the graph. On the weekends, people are kind of closer together because they're trying to go back to being normal. Well, maybe this is our new normal, right? To make sure that we're wearing our mask even though we're in a public space, to make sure that we're washing our hands, and to keep reminding ourselves that if we're going to touch anything that is high traffic, a doorknob, you go out somewhere in public, you got to wash your hands, back to 101.
Everybody has a role to play. It's not just up to the government. It's not just up to us. It's up to everybody to help to deal with this.
Let's see, do we have any additional questions? Okay, for those that are still watching and who track it daily, the numbers are coming out. They should be out here momentarily. We do put statistics on our website. Even though we don't do a daily briefing, still we brief every Wednesday, myself, the city county health officials, usually it's Annette Rodriguez, and then Judge Canales, and then Mayor McComb. But I did want to just point out that we got our numbers. I just want to make sure I get the right. I want to look at the chart real quick here. So this whole week has been, as I said in the beginning, we've had some pretty high numbers. So today we're reporting 15 new cases, and that follows yesterday's 11, the day before is 7, Tuesday's 3, and then Monday's 11. So this has been a pretty big week in terms of number of new cases, and wraps up with today with 15 additional new COVID cases. So what Dr. Dante just said, and Dr. Bird and I said in the beginning, we need to get back on it if we're not, and continue it if we're doing it, which are those preventative measures, right, to keep yourself safe and your family safe. So With that, that concludes today's press briefing. We'll be back here live on Wednesday, and that will be with myself, our County Judge Barbara Canales, Mayor Joe McComb, and Annette Rodriguez, our Public Health Director. In the meantime, our website's being updated, although this weekend, because it's tougher to get information now from the private sector and to some extent from our own lab, we won't be updating the numbers on the weekend. So the website dashboard will be reflective as of today on Saturday and Sunday, but Monday we'll update it for the weekend and Monday as well. Did you want to translate that, Gabby? Let Gabby translate that, as that's important if people are tracking this. So that being that no update over the weekend because we're not getting good data, so we kind of suspended updating it over the weekend. And then, but it's still live, it's still on the website, and it reflects data from today, as of today. And then Monday we'll begin to update it again. That's the protocol going forward.
Las cifras más recientes, recibidas hace solo unos minutos, es de 15 casos para el día de hoy. Esta semana ha sido una semana en donde más número de casos se ha reportado desde que se ha tomado el registro de los casos por el coronavirus. Toda esta información se encuentra en el website de la ciudad y el día de hoy es el último día en que se actualiza la información. Esta no se va a actualizar durante el fin de semana, pero el día lunes va a continuar la actualización de todas las cifras debido al coronavirus. Esa dirección es www.cctexas.com/coronavirus.
Okay, great. Thank you, everybody.